Welcome to the 4D Med Update. I'm Andy Zajac. On the program today, we discover how virtual therapeutics will revolutionize medicine and learn how virtual reality is more than just using it for gaming. Joining me today to discuss this topic is Dr. Neville Shimmin, Director at 4D Med. Welcome back to the show.
Thank you, Andy. It's a pleasure to be back.
Most people associate VR with games. Is there more to VR than just gaming itself?
Great question, Andy. There is indeed. Gaming aspect is because VR is able to create a really immersive experience, changing the perspective of the gamer to really believe that they're in an environment that they can control. And it would surprise many people that this technology is being used for at least 10 years now on the research side of things, and also now practically in training methodology, in training programs, and in medicine to treat numerous conditions. But its application has been extensively in psychiatry to deliver real solutions to help people's lives.
How can VR assist in training students?
VR provides students with the ability to practice, which really means that students can assimilate the task and environment they're operating in. Practice physically improves your hand-to-eye coordination, decision-making, and workflow. The real benefits of VR are not so apparent. It has to do with how the student's mind is free from distractions and allowed to focus on learning elements, allowing the student to control their learning environment, customizing instructors, information content, and even the style, and delivering information not just on anatomy and physiology, but on emotional and social impacts affecting these parameters is important and an advancement in learning style in itself. Technological advances in medicine have been at an incredible pace, Andy. New therapies, surgical techniques, pharmaceuticals, to name a few, have allowed even pernicious diseases such as cancer to be fought very effectively. However, the big concern has always been that patient outcomes and satisfaction with care has not improved so dramatically. How VR can be used to address the emotional and social impact of disease will be important to treat the ubiquitous consequence of illness, and those are depression, anxiety, pain, and fear. VR can incorporate these touch points in simulated environments as the student's learning, not just as anecdotal touch points.
How can VR support patient care?
Well, Andy, psychologists and neurologists have identified things like misperceptions in interoceptive awareness. That concept is about the strength of the body to mind connection. For example, if I were to say to you, imagine using a piece of string, how wide your circumference of your waist is. This would be a good connection between how you interpret the width of your waist from your own internal clock. And abnormal changes in brain chemistry and anatomy are also cause disease and affect well-being. So our internal emotional barometer influences our heart rate variability. If we are overwhelmed by stimulus, our heart rate can speed up and lose its rhythmic connection with our breathing, a so-called panic attack. VR can simulate exposure to fearful stimuli and provide feedback to the patient directly so they can monitor and better control their own response. Patients with dementia, for example, if provided with an opportunity to self-rediscover information, are better able to fend off depression and anxiety. There's a therapy called VR reminiscence therapy, which places the dementia patient in a simulated familiar environment, like their home of the past prior to their illness, to stimulate their mind by remembering previous events. Could be TV shows, world events like the election we're about to have in the US. A feature of schizophrenia is auditory hallucinations, so-called hearing invisible voices. VR therapy has been developed to give a digital face to these disturbing voices in the form of an avatar. This allows the patient to replace an overactive, unbridled mind with one having more structure, with an affirming state of control. In patients that have suffered severe burns, they're in incredible pain. And this has been controlled in VR environments by redirecting their attention to processing visual information that reaffirms their state and makes them more happy and relaxed.
What is unique about VR in these two scenarios?
There's an enormous amount of research, specifically in the field of psychology, Dennett's work, for example, that really explains the concepts of VR, but they're not really touched upon. But one of them is VR can displace other burdens of the mind. Our mind is constantly chattering. It's constant information and distraction because we're foraging for information, and that's what distracts us. VR helps balance the mind. It's almost like cognitive Tai Chi. So VR promotes cognitive flow. You might have heard of this flow before. Racing drivers speak of it a lot, where they're in the zone, or athletes or businessmen, where they're totally focused on achieving specific goals. That's because the brain is being used to a greater extent, part of the cortex, to process a task. In this case with VR, visual information, so you can make more focused decisions. So you can achieve better cognition or flow through VR, as it offers you a new, more engaging perspective and moves your spotlight of attention intentionally onto learning points. You stop just looking at information where inattentional blindness can limit your focus. The VR in the immersive and stimulating environment fires up the brain to give attention to things of importance. So VR is mind altering. There's a concept, it's a bit like a digital psychedelic, which supports learning and perspective changes, useful in multiple different sectors.
How is 4DMed developing its technologies?
That's another great question, Andy. The VR landscape right now, we separate it into hardware and software. Hardware manufacturers are churning out ever more sophisticated and powerful VR headsets, which are now displaying images in beyond 4K. So incredible hardware. And we've been working on our own headset, but realized that we simply can't keep up with all these advances with the leading manufacturers. So we're incorporating our sensors into their headsets, and we will continue to develop our own specifically for surgery. But making the best of both of these parallel streams makes sense because the technology is moving ahead so quickly. On the software side of things, we're developing realistically rendered libraries of objects and equipment. This is really important because part of the real benefits of having a VR environment is to generate this aspect of realism, of immersion. So you need to create highly accurate and realistic virtual hospitals, procedure rooms, surgical bays, whatever it may be, anatomical dissection room. So the focus is having our programmers developing a customizable sandbox to be able to replicate these environments, because each university, each institution will have its own idiosyncrasies, and those need to be captured to develop a really immersive experience, because that realism fosters and it engages the student, which is the driving force of the VR experience and the advantage it provides for the education experience. So that is the focus, rather than just produce a small scale simulation, which a lot of VR companies are doing to demonstrate proof of concepts. It needs to go beyond that, and that's really understanding the back end of the science, which we do.
How does 4DMed aim to leverage the benefits of VR?
So I think, Andy, Google are a good example of this. They have a Deep Dream, a program that helps their scientists see what a deep neural network is seeing when it's looking at an image, say of a cat or a bird. So 4DMed is creating an immersive environment, complete with organizational, cultural aspects that represent the world of medicine and capture the attention of the student. Now this, is deliberately nebulous, so not to give away any trade secrets. But the task with achieving certain goals by those students is linked to knowledge retention and an understanding of complex concepts. So that links back into really creating that environment that creates cognitive flow more reliably. and deliver a new perspective to the student through the simulation, and reduce inattentional blindness by promoting selective attention. So these are the things that will drive the ability for the student to be more effective with their time. Another thing that we've always wanted to do, because it's a holistic company and we've all, as students, suffered, I suppose, stress and anxiety of sitting exams. Lord knows I've set my fair share. So students are increasingly under pressure to perform. VR can simultaneously empower them to control their emotional barometer and anxieties to increase performance in exams. So one of the things that we've been reluctant to mention earlier, but we've always had as a parallel stream of development, is to change the learning experience, but also empower the student to better operate in that environment.
It sounds like there's a lot to look forward to in the future, and I'd like to thank you for joining us on the show today.
Thank you, Andy, for this opportunity to discuss more generally about the incredible research that's been conducted by psychologists across the world, explaining how this technology has a foundation that underpins its capability to change people's lives and ability to learn.
And that's our show. Thanks for joining us. I'm Andy Zajac. See you next time.